In the small town of Brooksville, nestled between rolling hills and serene meadows, Dr. Emma Harper lived a quiet, unassuming life. She was known to most as the town's sole general practitioner, working tirelessly at the Brooksville Community Clinic. Emma's slight frame, kind eyes, and soft-spoken demeanor made her a comforting presence, but her humble nature often led others to underestimate her abilities. Emma had always been passionate about medicine. Growing up in a modest household, she had worked hard to put herself through medical school, driven by a deep-seated desire to help others. Despite graduating near the top of her class, she had chosen to return to her hometown to serve the community that had nurtured her. The clinic was small, with limited resources and staff, but Emma's dedication kept it running smoothly. She treated everything from colds to chronic illnesses, often going above and beyond for her patients. Yet, despite her efforts, there were always those who doubted her capabilities. Some believed she was too young and inexperienced, while others thought a small-town doctor couldn't possibly possess the skills needed for complex medical cases. One crisp autumn morning, Brooksville was rocked by unexpected news. A mysterious illness began to spread rapidly through the town, causing severe respiratory distress in those affected. The local hospital, already understaffed and overwhelmed, was quickly inundated with patients. As the illness spread, panic set in. People began to fall seriously ill, and the hospital's resources were stretched to the breaking point. The town's mayor, desperate for help, called an emergency meeting of the town council. Among those present were Dr. Emma Harper and Dr. Richard Matthews, a renowned specialist from the city who had been called in to assist. Dr. Matthews was everything Emma was not: confident, charismatic, and highly respected. He took charge immediately, ordering tests and coordinating with the hospital staff. Though Emma was more familiar with the town and its people, she found herself sidelined, her quiet voice drowned out by the urgency of the crisis. Determined to help, Emma threw herself into her work, treating patients at the clinic and conducting her own research into the mysterious illness. She spent countless hours poring over medical journals, analyzing test results, and consulting with colleagues. One night, as she was reviewing patient data, Emma noticed a pattern that had been overlooked. The most severe cases seemed to share a common link: exposure to a specific strain of mold that thrived in the damp basements of many older homes in Brooksville. Realizing this could be the key to understanding the illness, Emma quickly compiled her findings and presented them to Dr. Matthews. Initially skeptical, Dr. Matthews eventually agreed to investigate further. Tests confirmed Emma's theory. The mold spores were causing a severe allergic reaction in those exposed, leading to the respiratory distress. Armed with this knowledge, they were able to develop a treatment plan and begin remediation efforts in the affected homes. With the cause of the illness identified, the focus shifted to treatment and prevention. Dr. Matthews, impressed by Emma's insight, began to rely on her more, valuing her local knowledge and expertise. Together, they organized a town-wide effort to clean and repair the affected homes, ensuring that the mold spores were eradicated. Emma's quiet determination and compassionate care won over her patients and colleagues alike. She worked tirelessly, often late into the night, to ensure that everyone received the care they needed. Her calm demeanor and reassuring presence provided comfort to those in distress, and her medical skills saved countless lives. The town rallied behind her, grateful for her dedication and expertise. Slowly but surely, the number of new cases began to decline, and those who had been seriously ill started to recover. The crisis, though not yet over, was finally under control. As the town began to heal, so too did Emma's reputation. The mayor and town council publicly acknowledged her efforts, praising her for her critical role in solving the mystery of the illness. Dr. Matthews, once skeptical of her abilities, became one of her strongest advocates, crediting her with the breakthrough that had saved the town. A ceremony was held in Emma's honor, attended by grateful patients, colleagues, and townspeople. Standing before the gathered crowd, Emma felt a mixture of pride and humility. She had always known that her work was important, but the recognition and gratitude of her community were more than she had ever expected. The crisis had changed Brooksville and Dr. Emma Harper forever. The town, once skeptical of its quiet doctor, now held her in the highest regard. Emma's clinic received additional funding and support, allowing her to expand her services and hire more staff. She also established a health education program to teach residents about the importance of maintaining safe and healthy homes. Dr. Matthews, inspired by his time in Brooksville, decided to stay on as a consultant, working closely with Emma to improve healthcare in the town. The two doctors, once strangers, became close colleagues and friends, united by their shared commitment to their patients. Emma's journey from a humble, underestimated doctor to a respected and celebrated hero was a testament to her strength, intelligence, and unwavering dedication. She had proven that true greatness comes not from outward appearances or accolades, but from the quiet determination to make a difference. Years later, the story of Dr. Emma Harper and the crisis in Brooksville became a source of inspiration for many. Her story was shared in medical schools, healthcare conferences, and community gatherings, a reminder of the impact one dedicated individual can have. Emma continued to serve her community with the same passion and humility that had defined her from the beginning. She mentored young doctors, sharing her knowledge and experience, and always emphasized the importance of listening to one's patients and never giving up, no matter how difficult the challenge. Brooksville thrived under her care, becoming a model for small-town healthcare. The legacy of Dr. Emma Harper lived on, not just in the town she had saved, but in the hearts and minds of all who heard her story. Her journey was a reminder that true heroes are often found in the most unexpected places, and that even the quietest among us can make a profound difference in the world.